Welcome to this Q and A video. It is Wednesday the 5th of February and I've been out of hospital now for I think maybe 2.5 weeks, 3 weeks, I think. So yeah, I posted on Facebook asking for some questions, and very kindly some people have posted questions. So I'm going to answer your questions now, just in the order that they were asked. So just very brief recap. Last month I had to go into hospital for emergency surgery because my bile duct got blocked again. That's because the cancer is growing in that area where where the liver and I think it's pancreas and bile duct kind of join up. And yeah, so I got I went into shock in around 7 o'clock on a Monday morning. Went to hospital, emergency surgery. After a week, there was no sign of recovery, so I had surgery again to place another stent in the bile duct. After another week, there was no recovery, but it wasn't getting worse. So the surgeon said I could go home, and been some monitoring since then. And the cholangitis, which is the infection around the bile duct, that was treated while I was in hospital, so that was all fine. Responds well to antibiotics. So first question, Wade asks, am I getting better? So there's two answers to that, really. There's the kind of no, I'm getting worse because I'm not having cancer treatment. I can't have any cancer treatment at the moment because because of the liver failure. So poor liver function means I can't have chemotherapy. There are possibilities of other treatments, so some immunotherapies that you can have even with poor liver function, some molecular targeted therapies as well. But yeah, I'm looking for those options, and so the doctors. So there's that. So at the moment, the cancer is growing and spreading. During the 3 weeks I was in hospital, another tumor appeared, so a third liver tumor, which is bad news. And yeah, more cancer growth around my bile duct, it seems, which is going to cause another blockage at some point in the future. But over the past few days, I've been recovering a bit from the 3 weeks in hospital and from the liver failure. And my liver is, slowly starting to recover. Generally, if you have a blocked bile duct and you have a stent successfully placed in the bile duct and your cholangitis is treated with antibiotics, you're generally going to get better in sort of 4 to 7 days. Obviously for me it's weeks are passing and my liver function is very slowly improving. And that's probably a couple of reasons for that. One is all the cancer treatment I've had over the 8 years does a lot of damage to the liver. I had half my liver removed, or 40 something% removed during liver surgery. It grows back, but it is still damaged. And I've had a lot of chemotherapy and I've had radiotherapy to my liver. And then another reason is I probably had acetaminophen poisoning because I was taking a lot of acetaminophen, or paracetamol as we Brits call it. I never went over the like a loud amount in a day, but I was having it for many days on end because of the cancer pain. And also, of course, I didn't know that I was getting liver failure, so my liver would have been in not a good way to process it, I guess. Yeah, so that's why the recovery, the kind of short-term recovery, has been difficult. But long-term recovery, no, definitely not better. Cancer is getting worse and will continue to get worse until or unless I can get some kind of effective treatment. And of course, I'm at the point now where lots of treatments are no longer effective. Judy asks, this is a general question, how bad is chemo and would you recommend it? There's a lot of nonsense talked about chemotherapy. A lot of that is by kind of idiots on the internet trying to sell supplements or so-called natural treatments or whatever. So chemotherapy is one of the sort of the three main ways that you treat cancer: chemo, surgery, and radiation. You'll hear people saying things like most doctors wouldn't have chemo and this kind of thing. That's all completely untrue. Because it's not a question, it's just not a question like chemo or not chemo, because there are many types of chemo, there are many ways that chemo are used. Cancer has stages. Chemo could be having a single treatment. So chemotherapy just means treating cancer with medicines. So chemotherapy could be a single treatment with a cancer drug to hopefully shrink a tumor and then remove it with surgery, and then that person would be cured, potentially. Chemo could be a late stage patient who is in a lot of pain because tumors are pushing against nerves, and the doctors recommend treating with chemotherapy and maybe radiotherapy as well to shrink those tumors so they're not pressing on the nerves, and then the person can enjoy a much better quality of life. So when you hear people talking about chemotherapy as this terrible, scary thing, that those tend to be very misinformed people. So to me it doesn't make sense, like, would you do chemo or not? That doesn't make sense, because cancer is such a complex set of diseases and there are so many circumstances. Another classic one you'll see is people saying they had cancer and refused chemo. The doctor said they should have chemo, they refused chemo, and they went on a yoga retreat or drank a green smoothie or had some Chinese herbal tea and now they're fine. Many of those stories, when you dig into them, will be things like someone has cancer, a surgeon says they can remove the cancer, and then they recommend 3 months of follow-up chemotherapy to kill any lingering microscopic cancer, and the surgeon does the surgery, and then the patient says, no thanks, no chemo for me, and then they go on the web claiming that they cured their cancer by natural means or whatever. So in a case like that, the chemotherapy is recommended because it's been proven over thousands of cases that it lowers the chance of the cancer coming back. Now, it could be that with a successful surgery, the chance of the cancer kind of reappearing is less than half. It could be. So then whether to have chemo or not as a patient is kind of a tricky situation, but whether to recommend it or not as a doctor is very clear. Like, well, if you do this chemo, it's not very pleasant, but you might do it 6 times over the course of of 3 months, and the chance of the cancer coming back drops from 35% to 7% or something. That obviously makes sense to do it if you're able to do chemo. There is another set of cases though about chemo, and again, it's why it's such a complex issue, and that's with very elderly patients, because with very elderly patients, even someone we would describe as fit and healthy, just being older means two things. First of all, it means often the cancer will spread and grow much more slowly. Secondly, it means that the person may really struggle with the side effects of chemotherapy. They may struggle with the side effects of lots of cancer treatment just because of we become frail when we're old. So that's a whole other thing. Is like, yeah. So would I have chemo if I was 75 instead of 45? Well, it's very likely the doctor wouldn't be recommending it, right? The oncologist would probably say, the guidelines recommend 3 months of chemo, but because of your age, that it may be better not to do it. So yeah, that it is an intensely complicated topic. I am fighting hard to make chemotherapy a thing of the past. I don't think it should be a cancer treatment, but at the moment it's one of the three main pillars of cancer treatment, and hopefully in the future it will be seldom used, or used in low doses, or used in high doses, but when it's injected directly into the tumor and it's not giving you all the side effects because it's not going through your liver or whatever, or your kidneys, or the chemo goes into your body but it's wrapped up in like a shell, and that shell only breaks open when it gets into the cancer cells. So that's a technology that is being trialed at the moment in Japan, among other places. So maybe there's a role for chemotherapy in that kind of way. But yeah, at the moment, chemotherapy is if you have cancer, you're likely to be treated with chemotherapy, and it's saved countless lives. It's also improved the quality of life for huge numbers of people. It's very easy for us to forget that, just a few years ago, amputation was a big treatment for cancer. Skin cancer on your arm in the 1970s, 1980s, amputation. Now we've got, chemo you can get chemotherapy creams. So, for example, I think with some skin cancer, get a 5-FU cream that you put on. Anyway, thank you. A good question. Difficult, complex answer, because it's a difficult, complex question. Okay. Lames asked three questions. Is there anything you'd have done differently? I guess fighting harder to get into trials earlier, but that's such a difficult thing. The whole cancer trial system is completely broken and stupid. The people involved they're not the right people. They don't have the right, so the people running clinical trials don't have the right skills to recruit cancer patients and to manage things. That they're not the right people. There's not the right culture around clinical trials for cancer. It's just a completely broken, messy, nasty thing. But getting into trials is important. She asks, have you thought of getting a second opinion from MD Anderson? MD Anderson is a famous, I guess, cancer hospital in the US. If you're outside of the US and don't have medical insurance for the US, then treatment in the US is not an option, really. Second opinion from US hospitals is astronomically expensive when you're outside of the US. I don't know how much it is when you're in the US, but you know, when I looked up the prices of like MSK, which is another famous cancer place in, I think it's in New York, $6,000 for like an email consultation, $9,000 for a short video consultation. Yeah, it's a non-starter. And there are lots of places outside the US now where the treatment is probably better than the US anyway. She also asks, how about a liver transplant? Often people ask about transplants, especially liver transplant. So generally cancer patients don't get organ transplants because if the cancer's early or found early, then there are hopefully lots of treatment options. If it's found late, then you don't generally want to give an organ transplant to someone who may not live very long, or if the cancer's spread and you give someone a liver transplant and the cancer comes back into the liver from wherever it's spread to, it doesn't really make sense. In the last few years, treating cancer spread to the liver by using a transplant has become a thing. It's pioneered in, I think, some Northern European country, Norway, I believe. But yeah, still, it's not generally that doesn't generally make sense for cancer patients to have organ transplants. Sarah asks, how are you feeling at this stage? I guess she means this pretty late stage, physically, mentally, and spiritually. I don't feel anything spiritually. I'm not a spiritual person in any sense of the word. Physically and mentally, I can't really separate the physical and mental at all. Often when I feel I'm struggling mentally, I'm just physically exhausted. So yeah, for me it's just kind of one thing. So yeah, at the moment there just is not a lot of fight left in me because I'm still kind of struggling to eat. I lost 5 kilograms during the 3 weeks in hospital, so there's issues with that. Like, I'm physically weak. Most of that 5 kilograms was sort of muscle because, yeah, I was pretty slim when I went in hospital, and lying in bed all the time, drugged up. I could walk around in a hospital, but only up and down one corridor. And because of the opioids and other drugs, I was kind of drowsy during the day. So yeah, my body took quite a thrashing. So at the moment I'm trying to get back to, put on a bit of weight, do some exercise. So Sarah, I'm kind of physically wasted. I'm sleeping a bit more, but that's still an issue. I'm on a lot of drugs I'm on drugs to try and make my liver work better. I have to take a drug every day because I developed a stomach ulcer, so I need to protect that from getting worse. So I'm taking a potassium competitive antacid for that, called Tachycab. I have tranquilizers at night. I have 24-hour infusion of fentanyl. So at the moment 2 milligrams of fentanyl a day, although I think that's probably going to go up tomorrow. I don't know if that's because the cancer's growing, causing worse pain, or if I'm getting used to fentanyl. I take another opioid once or possibly twice during the day as well. So there's all the drug side effects. They cause appetite suppression as well. So fentanyl causes appetite suppression, and there's other there are other physical effects from the drugs that make daily life very difficult and make me feel very bad. So if I was a spiritual person, I guess I would say I'm okay. But anyway, thanks for the questions. That's awesome. Maria says, dealing with appetite. How am I dealing with appetite loss? How about the taste changes? How do hospitals help you gain weight? What specific foods are you, or eating plans or whatever, are you following? So first of all, I mean, dealing with appetite loss is difficult. I think the fentanyl causes me to have a very dry mouth, so that makes eating is not particularly nice. So now I'm out of hospital. I'm just trying to eat little bits of different foods, whatever I can manage. When I first came out of hospital, all I could really manage was bread, and not much of that. I'm trying to add more protein in. So the eating is difficult. How do hospitals help you gain weight? Well, and I should say, like, 5 kilograms sounds a lot of weight to lose in hospital, but I mean, humans can lose quite a bit of weight and still be okay. It's not good as a cancer patient to be losing weight because that's associated with immune suppression and stuff. But yeah, as far as medically is concerned, it's not a big deal for most patients to lose weight in hospital. I mean, you're getting your nutrition, because if you're not eating in a hospital, then they're giving you a nutritional drip. So I was on 24-hour-a-day nutritional drips, and then when I was just sort of over the cholangitis, I guess, after a few days, then they were giving me solid food. I could only eat little bits. They give me lots of like jelly and yogurt and soup and that kind of stuff. And they can give you like what are called meal replacement shakes, so kind of protein shakes and stuff. Depending on the nature and cause of the appetite suppression, that can be helpful or not be helpful. Generally, I found like the appetite suppression I've got, it's kind of, you don't want to sit and drink a meal replacement shake. A cup of tea you can manage with like half a teaspoon of sugar or something, but at the moment I'm just trying to eat as much as I can, and aiming to put on like 0.5 kilogram of weight a week initially, and maybe try and get up to like 750 grams or even 1 kilogram a week. And so I think since I've been out of hospital, I've put on something like 1 kilogram. If I can get like another kilogram on, then it would be maybe time to push with the exercising as well, and lots of protein to try and build back some muscle. Jennifer asked how my 2 kids, what support do they need and have. They're doing okay, I think. It's obviously difficult for them when I'm not here. What support they have, I don't really see they have any, but they have each other, I guess. Yeah, so now I'm out of hospital and I try and spend time with them, but of course I'm going to medical appointments and stuff. I'm I'm having medical consultations. I'm also looking for treatments myself. So it's that's difficult, really. My daughter's busy with school and schoolwork, and my son is busy with his online school and it's exam time at the moment in Japan. So so not really a good answer to that, Jennifer, but yeah. Okay, last question. Dana asks, how are you mentally and how can we help? Mentally, for me, it's just like physically, I don't. I'm limited on what I can do. Getting to different consultations and stuff, that kind of thing. Trying to make clear treatment decisions and stuff when I'm physically tired or in pain. So I'm in constant pain. The fentanyl kind of has been effective, but it's now not enough. Maybe I don't know if that's because the effect gets weaker or because maybe the cancer's growing and it's causing more pain. I'm going to increase the dose probably next time I have a medical consultation. Increase the dose of the fentanyl patch, but the side effects increase pretty much in proportion with the dose, and the fentanyl causes drowsiness in the daytime and general mental fogginess and stuff. How can we help? Well, unfortunately, the answer is always the same, which is if you can share the fundraising link, it really does help. Because funds means it means I'm able to have treatments that are not covered by the insurance. Means I can have tests that are not covered by the public health insurance as well. It gives me options that make a big difference. So sharing the fundraising link, matthewdons.org, that makes a big difference. Donations have been coming in recently. That will pay for some immunotherapy that I can have even with very poor liver function, because this immunotherapy is grown from my own white blood cells, so it doesn't sort of get digested by the liver or anything. So that's all the questions. Thank you so much for your questions. Please give me more questions. It's really helpful because it makes me think about stuff in a useful way, and hopefully other people benefit from the answers as well. So please, wherever you see my videos, put a comment with questions, and thanks a lot.